Good afternoon. Joining me today are our Health Secretary, Dennis Schrader, Brigadier General Janine Burkhead of our Vaccine Equity Task Force, Executive Director of the Maryland Primary Care Program, Dr. Howard Haft, and Adam Kane, who is the Chairman of the Maryland Health Services Cost Review Commission. This is an exciting day for Maryland. We are now one big step closer to reaching that light at the end of the tunnel that we've all been talking about. Today, exactly 1 year after confirming the first Maryland death from COVID-19, our state has officially surpassed the milestone of 2 million vaccines administered. It took 67 days to reach the first million doses, but just 27 days to double that and reach 2 million doses administered. Maryland is vaccinating residents at a faster rate than 34 other states. We've vaccinated more people than 34 other states and administered more vaccines at long-term care facilities than 37 other states. We're now averaging a record 43,034 shots per day, which is an increase of more than 1,300%. Thanks to Secretary Schrader and his team at the Maryland Department of Health, as of today, nearly 25% of all Marylanders have gotten a vaccine, including nearly 2/3 of all Marylanders over 65. We now have an infrastructure capable of doing 100,000 shots or more per day. As of today, the Six Flags America vaccination site has done more than 100,000 vaccines. Tomorrow, I will be making numerous stops all across the Eastern Shore, including the new mass vaccination site at the Wicomico Youth and Civic Center in Salisbury. We will open our 6th mass vaccination site 1 week from today in Western Maryland. In addition, we're in ongoing discussions with a number of other jurisdictions regarding additional mass vac sites, and we'll likely be making further announcements regarding that in the coming days. We now have 2,424 different distribution points all across the state of Maryland. Maryland created the most advanced equity plan in the country, which continues to focus like a laser on our efforts to reach underserved communities. In early January, we launched the Maryland Vaccine Equity Task Force, which is working with trusted community leaders and local health departments to focus COVID-19 vaccination efforts in vulnerable, hard-to-reach populations. 50 task force missions have already been completed or are currently in progress all around the state, with more to come. As I've repeatedly stressed, the biggest challenge that we're faced with continues to be supply. That's what all states are currently receiving a limited supply from the federal government. Fortunately, there's finally some really good progress on that front. Last week, you all heard President Biden announce that every adult in the United States would be eligible for the COVID-19 vaccine no later than May 1st. Earlier this week, we had a meeting with the White House Coronavirus Task Force where America's governors were informed that not this week or next week, but beginning the week of March 29, all states would begin to see a significant increase in vaccine supply. And based on Maryland's rapidly accelerating vaccination rate, the infrastructure that we have built, and this anticipated increase in vaccine supply from the federal government, today I am pleased to announce that the state of Maryland will now enter phase 2 of our COVID-19 vaccine plan. Beginning next Tuesday, March 23rd, under phase 2A, all Marylanders aged 60 and older will be eligible to receive a COVID-19 vaccine. And immediately, effective today, any Marylander over the age of 60 can pre-register for a COVID-19 vaccine appointment at any of the state's mass vaccination sites by visiting covidvax.maryland.gov or by calling the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX. Once pre-registered on our new registration system, eligible Marylanders will then be notified once an appointment is available, and will be able to verify their pre-registration status and reserve appointments for vaccines. Nearly 90% of the state's 7,929 COVID deaths have been Marylanders over the age of 60. By prioritizing this age group, we will take a huge leap forward in the effort to protect our most vulnerable citizens from this virus. 1 week later, on Tuesday, March 30th, we will move into Phase 2B of our plan, which will include all Marylanders 16 years and older with underlying medical conditions that increase the risk for severe COVID-19 illness, and they can start to be vaccinated. According to the CDC, nearly 90% of all the individuals hospitalized for COVID-19 have had an underlying medical condition. The third and final wave of Marylanders in Phase 2 will become eligible for COVID vaccines beginning April 13th. This Phase 2 includes all Marylanders 55 and older, as well as all essential workers of any age in critical industries, including food services, utilities, construction workers, financial services, IT, and many other infrastructure categories. Finally, no later than Tuesday, April 27, Maryland will enter the final Phase 3 group, which will include every single Marylander over the age of 16. I want to stress that even though we're now moving into Phase 2 of our vaccine plan, all individuals who are currently eligible under Phase 1 but have not yet been vaccinated will continue to be prioritized for appointments at all of our mass vaccination sites. I also want to continue to remind Marylanders that just because you become eligible for a vaccine does not mean that you can immediately get a vaccine, and that we can't schedule appointments for vaccines that we don't have or that don't yet exist. Supply will be ramping up to meet all of the demand, but to be clear, we do expect that demand will continue to outpace the supply for at least the next several weeks. With the announcement of this plan, now every single Marylander knows when they become eligible to receive a COVID-19 vaccine. Our goal throughout this process remains the same. We do not want to leave any Marylander behind. And to achieve that goal, equally as important as moving forward with our phased, data-based, well-thought-out vaccination plan is to also continue expanding the channels available to Marylanders to get vaccinated. In addition to the current 6 mass vaccination sites, we have clinics at 227 nursing homes and 1,700 assisted living facilities. As of today, we're now increasing to 275 pharmacies, 38 hospitals, and our 24 county health departments. Our plan calls for the number of distribution points to continue to grow nearly every day. In addition, today we are launching an innovative pilot program to provide vaccine doses directly to primary care practices throughout the state. All these steps allow us to continue to provide a faster, more equitable vaccination response in Maryland. Maryland's primary care practices have been essential in our COVID-19 response here in Maryland, from pivoting to telehealth services to standing up COVID testing clinics. These providers already have trusted, long-standing relationships with their patients, which are critical to helping us boost vaccine efforts. And with this innovative program, primary care providers will be able to call their patients directly to schedule vaccine appointments, which will minimize technological and access barriers and reach individuals where they are. This initial pilot that we're launching today will include 37 practices throughout the state, including ones that serve largely African American and Hispanic patients and those that serve communities with less geographic access to other vaccination sites. This program is made possible through an existing partnership of primary care and public health within the Maryland Primary Care Program, which is a statewide advanced program that connects the Maryland Department of Health with 562 primary care practices across the state. In addition, we are launching a new $12 million COVID-19 community vaccination program led by the Maryland Health Services Cost Review Commission. This program will fund hospital-led community-based vaccination initiatives by utilizing Maryland's one-of-a-kind Maryland model healthcare finance system, which was initially conceived, designed, and accomplished by Secretary Dennis Schrader, and which has been called the most innovative in America. As leading healthcare providers in our communities, hospitals are uniquely positioned to support local community-based vaccination efforts. Many have already partnered with us to undertake vaccination efforts all across the state, and including through partnerships with local health departments and community-based organizations. But through this new grant program, hospitals will now be able to expand to work with even more trusted community partners, including local health departments, nonprofits, faith-based organizations, and others, to increase Marylanders' access to the COVID-19 vaccine with a focus on vulnerable, underserved, and hard-to-reach areas. From day one, our state has played an outsized role in the fight against COVID-19. More than 40 Maryland companies and institutions have been involved in developing tests, COVID-19 vaccines, and therapeutics. And Maryland has led the nation throughout this COVID crisis, and we're continuing to lead with our vaccination efforts. And now we are the only state in the nation that has the infrastructure already in place to launch a partnership of this kind with our state's hospitals. Finally, today, through the Maryland Vaccine Equity Task Force, led by General Burkhead, we are announcing the launch of mobile vaccine clinics in hard-to-reach rural areas of the state. And by utilizing mobile units provided by the Maryland School of Nursing, these units will be deployed and staffed by the Maryland National Guard. And I'm looking forward to seeing them in action tomorrow with the General on the Eastern Shore. As we continue to leverage every possible resource we can to get shots into arms as efficiently and equitably as possible. We have built the infrastructure capacity, and we're being promised the increased supply to be able to vaccinate every Marylander in the next couple months. I can assure you that Secretary Schrader and our entire team will not rest until every single Marylander who wants a vaccine has received a vaccine. And I want to ask all Marylanders to please get vaccinated when it's your turn. These COVID-19 vaccines have been proven to be safe and effective. They're administered under medical supervision, and getting vaccinated is absolutely vital to stopping the spread of COVID-19 so that we can return to normal life once again. I want to sincerely thank all of the vaccinators, the Maryland State Health Department, the Maryland National Guard, our hospitals, pharmacies, and local health departments, and the literally thousands of dedicated people who have been literally working around the clock 7 days a week to help us reach this moment. And we owe them a tremendous debt of gratitude. At this time, I'm going to turn it over to Adam Kane,